Is there a non-surgical facelift that works? Absolutely. It's really a home run using a non-surgical procedure to give you a balanced and a refreshed look. And basically how we do that is we divide the face into three tiers. The upper one-third, the middle one-third and the lower one-third. In the upper one-third we would typically give Botox to relax the muscles of facial expressions, so whether it's in between the brows, or it's the crow's feet or the forehead lines. And then in the middle one-third is where we add all the volume, because the hallmark of aging is volume loss. People look older because they deflate, and the function of the soft lift really is to reflate you and to get the volume back, to give you a balanced look. And so if you can imagine, the perception of youth is a wide mid-face or like an inverted egg. So you want the upper part of your face to be wider and the lower part to be narrower. And you can create that with the liquid facelift or a soft lift. And in the middle one-third of the face you would add volume with a relatively thicker filler that has a capacity to lift the cheekbones. We used to treat folds, the nasolabial folds, but it's not something that we do regularly, because the idea, number one, is to not to make you look like a monkey face, because that's not the most appropriate aesthetic outcome. The idea is to make you look refreshed, give you higher cheekbones. And if you look at all the magazines, and if you look at the women, they all have a face that is wider in the upper one-third and sort of narrow in the lower one-third. So that's the kind of look that we're trying to create. In the lower one-third, you can shape the jawline, you can shape the pre-jowl area where a lot of women have trouble because as they get older they sag and they deflate. So we use fillers, relatively thicker fillers, to redefine jawlines, to enhance the lips, and to basically turn the frown upside down.